Hey guys, welcome to another podcast episode on Men Up Malaysia, a space where we can get together and talk about men's health, including sexual health. And today's topic is for men who are about to become fathers for the first time. Yes, she's pregnant, what every soon to be dad should know. So if you want to know stuff like what checkups your wife need to go for, when will you know the gender of the baby, or even can you have sex while she's pregnant? Well, stay tuned because I have gynecologist and fertility doctor, Dr. Chong Kuoh Ren, with us to talk about this topic. Hi, Dr. Chong, how are you?
Hi, Kevin. I'm doing very well. Thank you.
Fantastic. So I got some good news to share, which is after 7 years, in the middle of this year, my wife got pregnant. It's our first baby. And so there's a lot of questions in my mind. And also, I'm sure maybe some other fathers, first-time fathers will also, soon-to-be fathers, that is, will also have this question. So maybe you can help us out and figure some of these things out.
Okay, good. Congratulations. Yeah. So congratulations on your COVID baby.
COVID baby, yeah, that's true.
So I mean, during the pandemic, some people say we will see an increase of number of births because a lot of people stay at home. Therefore, more chances to procreate and get pregnant.
Yeah.
So
in your practice, have you seen more people coming nowadays? Are there more pregnant mothers?
It's actually static. Okay, It's a bit static. So I mean, there are couples who, because of the pandemic, they are more fearful of getting pregnant because of the uncertainties and all that. And of course, on the other hand, there are those who, because they are at home more often, then they get pregnant. So it sort of balances it out.
Well, Dr. Chong, since we're on the topic of COVID, something not in our topic for today, but maybe you can just explain a little bit about the vaccines for pregnant mothers.
Okay, yeah. So the vaccine has been out for more than half a year already, and a lot of Malaysians have vaccinated adult population, including pregnant women, and also I think all over the world at least a few 100 million women who are vaccinated. So in general, vaccines are safe in pregnancy. Okay, so even before COVID came out, we are encouraging vaccines for pregnant women as well. So the common ones we give are the flu vaccine. We give anti-tetanus vaccine, for delivery. If they do a home delivery, then we're afraid of getting tetanus injections. So those are actually very common. Yeah? So those have been around for a long time, and it's also very safe. Okay, so COVID, in one sense, because it's sort of an emergency, so they do not have a lot of time to test out in pregnant women. Yeah, so the fear initially was whether the vaccine will harm the pregnancy, and there's this talk about RNA, DNA. Okay, so sounds very suspicious, sounds very scary, but I reassure you, this DNA will not be integrated into the baby. It will not harm the pregnancy.
Even if you're breastfeeding, it won't be transmitted to the baby, right?
Yeah, correct. So the time for vaccine would usually we wait until the 14 weeks. That means we've cleared the first trimester. The first trimester is when all the internal organs are being formed. So probably we want to avoid that time. So after 14 weeks, then it's safe already. And pregnant women, they are most dangerous or most at risk of getting severe COVID is during the later half of the pregnancy. When the tummy is big, they can't breathe very well. That's where severe COVID may happen. Okay, so you brought up breastfeeding as well. Yep, it's safe for breastfeeding. In fact, if the mother has the COVID vaccine and she has antibodies, the milk will pass in through the through the milk and pass it on to the baby. So the baby will get some antibodies, which is protective.
Just want to go back. You said something about later pregnancy is when more likely to get COVID, right? Did you say that?
Okay, correct. Yep. So I mean, the changes of pregnancy starts even on day one, so they have morning sickness and all that. But as the tummy gets bigger, so physically the lady's lungs and the diaphragm are a bit more, because of the size, so they can't breathe very well. So their lung function and lung capacity is also restricted. So this makes pregnant women at a disadvantage, especially if they get COVID infection. Okay, so those severe cases where they affect mother who have passed away usually affect those in the second half of the pregnancy, not the earlier part.
All right, great. So, Dr. Chong, upon hearing the news that your wife is pregnant, what are the medical processes that the woman couple need to do?
So when the when they find out they are pregnant straight away, of course, the first thing is to confirm the pregnancy. Nowadays, the urine pregnancy tests are very reliable, so it's going to be correct 99% of the time. So the next step will be, of course, to do an ultrasound scan to confirm the pregnancy. Now, you don't have to rush out immediately. You do the pregnancy test, by afternoon you go for a scan. You don't need to be super, excited about this.
Mhm.
So in general, if you come in for a scan too early, we are not able to see the pregnancy on the ultrasound. Okay, the earliest we can see the baby or the pregnancy sac is about 5 weeks of pregnancy. So 5 weeks of pregnancy means 5 weeks from the last menses. Okay, so in general, women have 4 week cycles. So on the fourth week or the fifth week, if they missed the menses and they checked, okay, positive, then we can see a small sac. Okay, but of course, sometimes womb is reverse womb, or the tummy is a bit on the thicker side. We can't see very clearly. Then you can wait for 1 or 2 weeks. Okay, so the bigger the pregnancy, then of course the easier we can see the baby. And baby's heartbeat, we usually will be able to locate it around 6 or 7 weeks of the pregnancy. So too early, we can't see the heartbeat as well.
So there's this thing. There's this thing about getting a pink book.
Okay.
What is the pink book all
So
about?
yeah, what's the pink book? So in Malaysia, we have two systems of delivery. One is the private healthcare, the other is the government-based one. So if you're planning for a delivery at a government hospital, you don't have to do all your checkup at the hospital. And so Malaysia has what we call a decentralized form, whereby the first 8 months of pregnancy, you can do your checkup at the nearby government clinic or the KK, Klinik Kesihatan. So when you're pregnant, usually when you're in the third month or fourth month, when the pregnancy is more stable, okay, then you can go for your booking. Okay, booking means registering with the clinic, telling them you're pregnant. Okay, then they open up the pink book. The pink book is basically a summary of the 9 months of pregnancy. So inside there, they write the details of the pregnancy, scans, any blood tests that you need, okay, and so on. So that book is sort of like a passport whereby the pregnant women can deliver at any hospital. They can go back to hometown and deliver, or they need to be referred to a specialist. Okay, so you can just bring that book along. And nowadays, the pink book, after delivery, you can use the same thing for your baby's vaccination as well, up to 5-6 years old.
So that's for the government hospitals. What about the private hospitals? You don't need a pink book?
In the private hospitals, different hospitals, they have their different system. Okay, some of them will be one small, tiny card where it's just an appointment based. And now most of them now they have their own version of this pink book. So it's similar. It's just a record of every visit, okay, any test done, what's the ultrasound, and a bit of a plan. Okay, so that anytime the lady needs to go any other hospital, okay, they can just bring it along, and all the important information is inside the book.
Okay, great. Now, Dr. Chong, men tend to be too protective of their wives, especially in early pregnancy. Like they're a bit worried. That we've heard stories of miscarriages and stuff. Not wanting the wife to do too much, but the wife also, wants to be normal and live a normal life. So maybe you can explain what sort of physical tasks pregnant women can or cannot do.
Okay, now the risk of miscarriage is the highest within the first 3 months of the pregnancy. Okay, because early part of pregnancy, sometimes we are not able to confirm whether the baby is healthy or not healthy. Okay, so if the baby can reach up to 12 weeks or 3 months and everything's okay, the heartbeat is good, the size is good, no bleeding, okay, then 80-90% we are quite sure the baby should be healthy. Of course, at around 3 months, there are special tests or ultrasound or blood tests that we can do to check the baby, whether the baby has some DNA problems like Down syndrome. Okay, that can be done around 3 months. So after that, if everything's A-okay, then pregnant women should be able to function almost as if they are not pregnant. Of course, later of the pregnancy, the tummy is bigger. Physically, she's not able to move around, not as agile. Then pregnant women definitely will pace themselves, okay, and don't overexert themselves. Now, a lot of things we worry about usually is about like exercise. Okay, can we, if the lady loves going for exercise, love her gym, can she continue back at the same intensity? So probably the first few months, actually advised to reduce the intensity of their workout. Okay, if they're used to jog for 1 hour, of course, try and trim it down, maybe 20 minutes, just to get the blood circulation movement. Okay, I mean, repeated physical pounding, jumping up and down, probably will sort of disturb the womb a little bit. So if you have never worked out in your life and you're pregnant, of course, don't start a gym membership, and go for all this high intensity workout, aerobics. Yeah, so just take it slow. Choose a low impact workout. Like brisk walking is good, cycling is okay, swimming is okay. Yeah, a bit of weight lifting should be fine as well.
Swimming is fine.
Swimming is okay. Yeah, swimming is okay because you're floating, you're not shaking a lot of things. Yeah, so that's all right. Okay, housework wise, no limits. No. But of course, this is an excuse to push all the housework for the husband. So the husbands need to pick up the slack.
Yeah. And what about driving? Something like driving, or if they're on a motorbike?
I mean, our Malaysian roads, not too bad. Okay, not too bad. Even though potholes here and there. Okay, so try not to go through a lot of potholes too much. Okay, so motorbike, because you're not doing anything, you're just riding along. So driving wise, probably drive a bit slower, be a bit more careful. Now you mentioned about driving. So as the tummy gets bigger, the seat belt. I hope everybody wears seat belt in driving. Pregnant women, seatbelt is also very important. Okay, so some women, when they're pregnant, they find the seatbelt very uncomfortable. They choose to go without the seatbelt, which is dangerous because accident can happen anytime. Pregnant, not pregnant, okay, it can happen. So make sure you follow the correct way of wearing the seatbelt so that you don't press on the tummy, but at the same time, the protection is there.
Okay, great. Now, one of the puzzling questions for couples at this time is how about sexual intercourse? Can they have sex?
Yep. Yeah, sure. Sex is okay. I mean, it's no problems. So a few things though. Okay, if there's any problems or complications in the pregnancy, for example, there's spotting or bleeding, okay, then probably try not to have any sexual intercourse for the time being. Okay, sometimes when we do a scan and we notice that the placenta is a bit low, placenta is the afterbirth, the tissue that gives nutrition to the baby. So if it's lower down, meaning the position of the placenta is covering the cervix, okay, where the baby comes out, then there's a higher risk of bleeding during the pregnancy. So in those type of cases, we would definitely advise to slow down or not to have sexual intercourse. Okay, the other thing would be at the later half pregnancy, sometimes the water leaks. Okay, so not term yet, but the water is leaking out. So that also we will try to avoid sexual intercourse because it may increase the risk of infection.
You mentioned about the placenta.
Barring all that, SI is okay. Yeah.
You mentioned about the placenta. You said it's covering the cervix, so it will move away from the cervix in time to deliver?
No. During early part of pregnancy, the placenta can, because the womb is round, the placenta can stick at the top, bottom, left corner. Yeah? So it's quite random. Now, early part of pregnancy, if it's very low down, then it's a bit risky. But as the pregnancy progresses, as the womb, grows bigger and bigger, then the placenta sort of grows up together. Yeah? So in general, if it's low at the beginning of the pregnancy, towards the 7 or 8 month, 70% it would have cleared and moved upwards already. So 80% of the time, it won't be an issue at delivery.
And for men, when they're having sex with their pregnant wife, is it okay to ejaculate inside of her?
They won't have another twins or triplets. Okay.
Yeah.
So yeah, it's okay, no problems.
Now, Dr. Chong, there are claims or research saying that talking to the baby in the womb has positive benefits, especially for bonding. Is this true? Should we be talking to the baby, or when can we start talking to the baby?
No, bonding with the baby, it's more of a psychological thing. So the benefit, I would say, it's probably more for the mom and more for the mother's side, okay? Because the baby is growing. Of course, the baby's sensory organs, for example, sound, smell, taste, okay, sight are still growing, okay? So it's not that well developed yet. So imagine a baby inside the amniotic fluid. Okay, so imagine you're swimming in a swimming pool. Okay, outside,
Right.
your wife or husband calling you, but you're underneath, swimming inside. You won't be able to hear what's going outside, because the sound it's just a blur. Okay, so some will say maybe the baby will start recognizing the mother's tone, mother's voice. Okay, so probably it's just getting the baby used to that sound. But after birth, the tone will change, because the baby's outside already.
Yeah.
And so probably won't be able to recognize exactly, oh, this is my mom, this is my dad, this is my older brother. I don't think the baby will be able to hear that, but it's more of, there's a reassurance that somebody's there, the baby's not alone.
But when do these the hearing and the organs, when do they start to take shape?
So the internal organs, the first 3 months of life. Okay, so the first 3 months, internal organs, especially, all of them grow in time. So around if you do a scan, you can see at even 8 weeks of pregnancy, the baby is starting to move already. Okay, because the muscle, the nerve systems are starts to grow. Okay, so sometimes, if you talk too loud, or the wife may just feel suddenly the baby's moving. Okay, responding to all these sounds and external stimulus. So I would say at 3 months, 4 months, the baby should be able to react to sound stimulus already.
And a common question that pregnant women get is the baby kicking? What does that signify? The baby kicking? Anything in particular?
Okay, so baby kicking, in general, first time mothers, you start to feel around the 4th month onwards. Okay, 4.5 to 5 months. That's the general time where they start really feeling the baby's movements. Okay, this is probably because a few hundred years ago there are no ultrasounds. Okay, so the only way to find out whether is the baby healthy or not is whether the baby moves.
Yeah.
Okay, so in general that happens around the 4-5 months mark. So if the mother hasn't felt the baby moving, then we are worried. Is the baby well? Is the baby growing? Any issues going on? Nowadays, when we have ultrasound, then we can see the baby's condition much earlier. But baby moving is still something we tend to ask mom. So when we start feeling the baby movements, then that's also more reassuring, because the baby is growing well. So once you start moving, then the baby's awake, baby's healthily kicking around. The thing is, during the last few months of the pregnancy, if the baby's movement slows down, or the baby stops moving suddenly, then we're afraid whether there's anything going on with the baby as well. Yeah.
What possibly can go wrong coming in the later months?
Okay, so in the later months, sometimes what we're worried about is the placenta. The baby's getting bigger, but the placenta function is not very good. So it does not supply enough nutrition to the baby. Okay, so the baby may, worst case scenario, maybe just pass away inside the tummy. Okay, so of course it won't happen straight away. There are a few signs, ultrasound, maybe the baby's growth is not as expected. The baby is smaller in size. The water is inside the womb is getting less and less and less. So those are key signs. So when we see this, then we make sure we have to tell the mom, make sure the baby is moving. If the baby slows down, then straight away you have to go to hospital and see whether there's anything wrong with the baby or not.
Another thing, Dr. Chong, is for some couples, the gender of the baby is very important. When are doctors able to determine the gender?
Now, on ultrasound, usually about the 4 months mark, actually 16 weeks onwards. Okay, so we can do ultrasound and have a look in between the baby's legs. Okay, that's the easiest way to check. Baby boys, of course, it's easier to check to confirm than baby girls. Okay, this is because the baby boy, there's the penis there, so it's a bit easier to see. If you want to see even earlier, we can actually do a blood test at around 10 weeks onwards by doing something called a NIPT or NICC. Okay, the genetic testing screening at around 9 to 10 weeks. So the report actually includes the baby's gender, okay, if you so wish to find out.
So how accurate is the scan?
The scan, the accuracy is better for boys. Okay, because if you see the penis, the structure there, then we are quite sure already.
But it's going to be very small, right, Dr. Chong? So can you really see it through the scan?
4 months is okay.
Oh,
4 months, okay. If we don't see it at 4 months, then we wait another one more month at 5 months. Okay, so usually for 5 months, we can see it. Now, conversely, if it's a baby girl, then sometimes the doctor will, will say, okay, can't see very clearly, it's not very clear. So if the doctor says, I can't see very clearly, it's not very clear, then the higher chance it's a baby girl. Okay, because baby boy is easier to see.
Right.
So that's also another clue whether it's a boy or girl.
Now, closer to the delivery date, couples would have prepared a couple of bags because they'll be in a rush, and I'm sure usually the wife packs the bag, not the husband. We always see this in the movies. What's in the bag, Dr. Chong?
Okay, so in the bag, depends how much of your personal belongings you want to bring to a hospital. I'm sure ladies, they want to bring the whole house if possible, the entire bedroom, entire toilet. Okay, so you can Google it. There's checklist of what to bring to make yourself comfortable. Okay, so you can break it down in a few things. Number one is for the mom, the expectant mother themselves. Of course, bring change of undergarments, maternity pads, maybe nursing bras. Okay, some own clothes, maternity gowns. Okay, that's for herself. Of course, bring some toiletries. Okay, you make sure you bring your toothbrush. You need to look good. When you are delivering as well. Okay, probably makeup you can not so much makeup. Okay, the other things you can bring is for the baby after the delivery. So you can bring some baby swaddle clothes, nappies. Okay, socks, baby socks, a little cap because the hospital is a bit cold sometimes. So the heat loses from the head. So things for the baby. You can bring pillows, because hospital pillows are known to be super stiff and not very comfortable at all. So you can bring some personal belongings. Now, during labor, maybe you want to bring your some music, iPod. You bring your phone, bring a lot of batteries, bring your charger. Okay, some magazines, to keep yourself occupied. Now, if you go to the hospital and you don't bring anything, okay, just yourself, So of course, the hospital, they have diapers, they have their baby clothes, so they won't keep their baby naked. But if you want to take photo of the baby newborn, then of course bring your own clothes. Okay, otherwise it'll be the hospital clothes. Then the hospital logo. If you're advertising for the hospital, then
branding.
it's okay. Yeah,
there's some branding there.
Yeah.
All right. So and speaking of movies and TV shows where we see them rushing with the bags and all that, there's also always a funny moment where the husband faints in the delivery room. Does this really happen in real life?
I've not have any husbands fainting on me yet. Okay, but usually it's because it's something very alien to them because they don't see it. Doctors we see it all the time, so it's quite new. Seeing the baby's head coming out from the wife's body, it's a bit like watching an alien movie. So it's could be a bit traumatic. So my advice for husbands who are a little bit faint of heart to watch some videos on deliveries on YouTube. Okay, so see it happen a few times. Okay, so make themselves desensitized. So when the actual thing comes out, then they're more prepared for it.
But should they be there in the first place?
Oh yeah, of course. So especially if it's a normal delivery, then the expectant mother needs all the moral support that she can have. So the husband has to take responsibility for getting the wife pregnant. So don't run away during the moment of pain.
Yeah.
So the husband is there, important to make her comfortable, bring her water. Of course, it's very important when the pushing during the delivery to keep the wife motivated as well.
And how do they do that? Any tips to get them motivated?
A good thing would probably be for the couples to attend antenatal classes. Antenatal classes, hospitals sometimes a few months or so, they have classes, half a day just to explain the process of delivery, each step of delivery, what to expect during the delivery, how the husband can help, how the wife can help, how to push, when the cervix is open. Okay, so it'll be good for the couples to attend such a class so that, they are not shell-shocked when the actual day happens. Yeah. So how the husband help is okay. So delivery is actually a bit boring. Okay, why do I say that? Okay, you see the movies. Okay, baby, the mother goes to the hospital. 20 minutes, the baby's out. Okay, so it doesn't happen that way. Delivery on average takes 5 to 10 hours.
Wow.
Okay, because the cervix is closed for the past 8.5 months. It's it's locked tight to prevent the baby from slipping out too early. So delivery process is the opposite. Okay, we want the baby to escape from this jail, or this protective area. So how this happens is the womb will contract, okay, very strongly. Okay, 10 minutes, maybe 3 or 4 times. So the pain is really quite strong. So it takes 5 to 10 hours for the delivery to come out. Okay, so if the lady chooses to have epidural, which reduces the pain by 90%, then it's just waiting for the cervix to open. So it can get a bit boring as well. But of course, if the lady doesn't have epidural, then it's very painful because you have to wait that 5 to 10 hours.
And another thing, sorry, I get all my education from movies. Sometimes we see the lady, the mother, water break, right? And she's somewhere else, of course. So how long from that time to the hospital? Do we need to hurry?
If it's the first time pregnancy, it may take 5 to 10 hours. Okay. The same rule applies. Now, those that you see on the newspaper, the pregnant lady delivers at the police roadblock, okay, and then the police have to help, or deliver at a hospital or in a shopping center somewhere. Okay, that is very rarely to be the first pregnancy. It's usually the second or third. Okay, so second or third, the cervix opens up much faster because this is the second or third round already. Okay, so if it's a first-time pregnancy, we actually have a lot of time. Okay, don't have to fly straight to the hospital. Now, one thing of note is if the water breaks, then occasionally the umbilical cord may drop out, or the baby's head is not downward position. The toes may come out, the legs may come out, the hand may come out. Okay, so that's one thing we have to pay attention. Okay, so if the cord gets pressed, or it slips out, then the baby movements will slow down a lot. Okay, so important is during water breaking, if the baby is still very active, turning around, moving a lot, then we have a lot of time. I mean, we have some time. So the lady can actually take a bath, have some food, do some final preparation of the kid to bring, then go to the hospital. Okay, don't have to reach there within 5 minutes or 10 minutes. Not necessary.
So is that the sign to go to the hospital? Is there any other sign?
Yeah, 3 signs of labor is going to start. So number 1 is the contractions. Contraction means the womb gets very hard and tight. Okay, usually it's a bit soft. Okay, so it becomes very firm and tight. So this firm and tight is very close together. Probably during the later half of the pregnancy, on and off, one or twice a day, there'll be some contractions. Okay, then it will stop. Okay, so it's the labor nears maybe from every 6 hours, the contraction will be every hour. Then from every hour, it becomes every 5 minutes, every 3 minutes. Okay, so as it gets closer and closer together, and after 2 or 3 hours, it's still contracting away, then it's time to get ready to go to hospital. Okay, the second sign will be something called a mucus plug leaking out. Okay, that happens when the cervix opens. Okay, so a sort of a jelly-like mucus together with a bit of blood will drop out. Okay, so this means that the gate is opening. Yeah, so then this mucus plug comes out. Okay, the third sign, of course, is the water breaking. Yeah. So water breaking, a little bit dangerous, okay, because the cord may drop out. The other thing is when the water breaks, then the risk of infection is higher. Okay, because there's a direct route, from the external environment into the baby. So water breaking, we tend to be a bit more worried.
But in all these 3 cases, we can drive them to the hospital, right? We don't need to call an ambulance.
No, don't need. Yeah. No. Sometimes the contraction is very strong, okay, especially first time. But when you arrive at hospital, the contraction stops. Okay. Then we check, the cervix is still closed, baby is healthy, heartbeat is okay. Sometimes we'll send the lady back home first. Okay, so first time delivery, the lady may have to go in and out of the hospital a couple of times before the actual labor starts.
A few false alarms, lah. Bound to
Yes, false
happen.
alarms.
Bound to happen.
Yes, yes, correct.
Okay, so Dr. Chong, when the baby is born, what can we expect? I mean, just angling this towards the health of the baby, like what home prep should we do?
Okay, so home prep, of course, the things you think about is when the baby is born, where will you keep the baby? Okay, are you going to feed it in your master bedroom upstairs, or is it going to be downstairs? Do you want it near the kitchen? Is it near the toilet? Okay, then of course the bed, you want to have the baby cot nearby. Okay, so these type of things you should probably plan ahead. Okay, where to keep the cot, and of course as the baby gets bigger, then you have to think about safety issues. Okay, if it's a double-story house, make sure the stairs, there's the sort of a gate so that baby won't accidentally tumble down the stairs. Okay, so I mean these are as the baby gets bigger and bigger. Okay, so more of the practical things.
In terms of the baby's behavior, sleeping patterns, and all that.
Okay, baby, the first 1 month of life, the baby is like a lion. Okay, sleeps 23 hours a day. Okay, they only wake up to feed and maybe to pass motion or pass urine. So they'll be sleeping a lot. Okay, so if you're worried about the baby having problems, of course the baby will cry and all that. So the first 1 week of life, probably the most things, common things that people are worried about is jaundice. So jaundice, it happens in all babies. Okay, definitely will happen. You'll start occurring around the day 3 of life. You'll peak around day 5, day 6. Then by day 7 or day 8, you'll start to go down. So why does this happen? Jaundice happens because in the tummy, before pregnancy, the baby's red cells, they are a bit different after delivery. Okay, so in the tummy, what it does is the baby has to absorb, recycle oxygen from the mom. Okay, so the air environment has 21% oxygen. So the mother breathes in, takes a bit of oxygen, and breathes out 16% of oxygen. So the baby in the tummy needs to extract oxygen from this 16%. So their hemoglobin is able to concentrate this oxygen. But upon delivery, so baby is breathing from outside already. So there's a turnover to a new form of hemoglobin. So this breakdown and turnover of a new one, that's what causes the jaundice. So the jaundice is that pigment, that green bowel pigment, green-yellow bowel pigment, okay, that forms. And so first 1-2 weeks of life, the baby's poo-poo, when they pass motion, you can see this pigment coming out.
So it'll just last for about a week.
Yeah, I mean, the peak is 1 week. Sometimes it goes up to 10 days, 2 weeks.
And I'm sure, Dr. Chong, that you may have experienced couples having a lot of panic moments and calling up or coming to see you in the clinic. Those panic moments, some I suppose are genuine, some are maybe not so much of a concern. Can you describe some of the common ones?
Okay, common one is probably during feeding. Okay, you feed the baby, then the baby throws up. Okay, or baby chokes on the milk. Okay, so this is sometimes because the baby can't control very well. So during feeding, then halfway the stomach is also not very stable. So sometimes the baby will vomit. So vomit, the material, the milk will go and irritate the lung tissue. Then the baby starts coughing. Then after coughing a lot, the baby will just throw up. Okay, because this is a sort of a reflex. So whenever the baby vomits, everybody starts panicking. So this is quite common. So if they vomit, if the baby is okay, there's no difficulty breathing, can just feed. Feed the baby again, and that should be all right. Hiccups are very common. Okay, because feeding, it irritates the diaphragm, then baby hiccups. That's very common. Of course, fever. Maybe we sometimes develop fever. The fever can be from the umbilical cord, which is infected. Okay, or maybe we get some infection, then baby becomes feverish. Okay, so that's also very common.
Okay, and just on an advisory note for all the soon-to-be fathers, I'm sure, when they start to think of having a child for the first time, they may want to consider their health as well, because they want to be there for their kid. So maybe you can advise those fathers to also take care of their health and some things that they should do.
Yeah, of course, definitely. I mean, being a father, I'm also a father to two kids. Yeah? So, when you see your baby for the first time, there'll be a transformation in yourself. Okay, so it's the best is you experience for yourself. So, you look at the baby, then there's a shift of attention from yourself, okay, to that baby. So naturally, you want to be more protective of the baby. You want to make sure you live longer so that you can see your baby grow up, enter university, make have a good career. Yeah. So of course, you have to take care of your health. So things like smoking, if you're alcohol, okay, or you have medical problems like diabetes and high blood pressure, okay. So make sure you get those things sorted out, okay, because you want to prolong your life, so that you can enjoy your kids' company. Hopefully they will grow up, they can get married, and you can be a grandfather as well. We know what we're supposed to do. Sometimes maybe we don't not supposed to smoke. We know we're supposed to take care of the diabetes, but sometimes we're a bit too busy, we're a bit lazy. Okay, but having a child, that will reprioritize everything.
Yeah, that's true. All right, Dr. Chong, thank you so much. I don't know whether these are silly questions or, but I think I've certainly learned a lot, especially talking about jaundice and all those kind of things that maybe fathers never thought of and just left it to the mothers to handle. But nowadays, we see men getting more involved in parenting and really being there for their children. So I'm sure a lot of our soon-to-be fathers, if they are viewing this, it'll be very beneficial. So thank you very much for this information.
Okay, no problems. And thanks for inviting me into your podcast.
All right, and looking forward to having you on the next show. For our viewers, if you don't know, I also spoke to Dr. Chong about male infertility. So if you're having problems, in getting pregnant, you want to check out the video. A lot of useful advice that Dr. Chong has given me. And of course, that was done a year ago, and a year now, I'm going to be soon to be that. So thank you again.
Good, great, good. Very happy for you guys.
Thanks, Doc. Stay safe, yeah.